And welcome back, everyone. You're watching Inside the Valley, and joining us this morning, we have Gilda Bowen, and we also have Martin Castañeda with Unidad. Thank you so much for joining us.
Thank you.
All right. It's a coalition that's trying to promote tobacco-free environments, right?
Correct.
A smoke-free environment. What does Unidad stand for?
Unidad?
Uniting Neighbors in Drug Abuse Defense.
And this coalition has been around for how long?
Actually, the coalition is brand new, about 4 months. We are part of a statewide Department of Human Services coalitions. We're 1 out of 9 with new funding, and we're here in the Valley covering the whole Valley with this tobacco prevention.
And what is your main goal?
To promote awareness on the effects of tobacco use.
And it can be very serious because you've worked on another coalition for a drug-free environment.
Correct.
And so you can see, or you can tell us about the dangers that not only drugs pose, but smoking poses, right?
Definitely. They have similar but different dangers, and a lot of people think that smoking or alcohol or tobacco use is not as dangerous, but after seeing the statistics, they realize that it does pose a lot of health hazards for them.
Yeah.
Not only for them who are using them, but people around them as well.
Yeah, I'm glad you mentioned the numbers because they are alarming. You sent me a flyer of just the facts, and when I was looking over that, I was really surprised to see. So tell us about some of those numbers.
Okay, Dina. Well, the amazing thing about coalition work and what we're doing here is that we're not really a program that's here to provide services to make people quit smoking. A coalition is so broad, and it really involves the community, and that's why we're here. We want to invite the community to be a part of it. It should be community driven. We're fortunate that we have staff to assist with that, but it is to help people bring awareness. As Martin was saying, tobacco use is the #1 preventable cause of death in the United States.
The #1 preventable cause of death in the U.S.
Correct. I mean, you're smoking. You're making a choice to smoke. Tobacco is now being seen, and it always has been. It just hasn't been identified as a substance. It is another substance like alcohol, like drugs, and is being treated as such. And the coalition work has a lot of evidence-based backing to support what we're putting out in the community. Education through the schools, community awareness through presentations, community movement through city governments. We are going to be looking in the next 5 years at working with city government on city ordinances. We're looking at laws that already exist but are lacking enforcement. We're looking at it's a health initiative. It is your community. You are here to live healthy, and we are kicking off a campaign in the next 2 weeks that's going to go for 3 months on Share Air, which is everyone has the right to breathe clean air. And it's called Protect Everyone, so we're really excited about just becoming known and aware and inviting community members to join us in these efforts.
And it's so important because I'm looking at your fact sheet, and when I look at that one that says smoking kills more people than alcohol, AIDS, car crashes, illegal drugs, murders, and suicides combined.
Correct.
That's startling.
It's not if you're going to get a cancer, it's which kind. A lot of people relate smoking with lung cancer, and there's a lot of other cancers, throat, stomach, esophagus, organs. There's so many diseases that are tobacco related that people do not realize when you look at statistics. If you track back the medical history, the use of tobacco.
And it's just so important. You know, if someone chooses, you know, they're listening to this right now and they make the choice right now to say, you know what, I'm going to kick this. I'm going to stop smoking. How much will their lives improve by just doing that?
Tremendously and immediately.
Yes, definitely, dramatically. They will thank themselves, and people around them will thank them. Smoking, if you're around people, they'll notice when you've been smoking. Your clothes get penetrated. You've got obvious signs of smoking, and when they make that change, those signs go away, and it's a healthier environment for them.
And they add years to their lives.
Exactly. And tobacco products, I mean, we're not just talking about cigarettes. There's also chewing tobacco. There's also the latest trend that we're seeing locally and everywhere across the nation is the electronic cigarettes.
Right.
Electronic cigarettes do not contain tobacco. They do contain nicotine, which is the addictive factor, and there are a lot of things that we don't know yet, and we're seeing ER visits mainly by young people.
Because they think they're better.
They think it's vapor. They think it's vapor. It comes in flavors, and it's attractive to young kids. But it's just as dangerous and maybe even more dangerous. So we're going to look more into that and share that with our youth in our community.
Let's talk about secondhand smoke, because you hear a lot of people now who die from secondhand smoke. First of all, what is it? And why do people die so quickly from this?
Well, basically, secondhand smoke is what it is. I mean, you're breathing somebody else's smoke. Asthma in young children, or children, period, or people. Secondhand smoke in workers. You work in restaurants, bars, or workplaces, public places where people are allowed to smoke. So the employee may not be a smoker, but the consumer is. And so that employee has a right to clean air, and so you're affecting someone else, their health, by you smoking. And so there's secondhand smoke. The third-hand smoke that Martin was talking about is basically smoke that penetrates into furniture, into
and there are health risks involved with third-hand smoke as well.
Just as much. It's their respiratory complications from secondhand smoke. So even if you don't smoke and you're around people that smoke, it's going to affect you. Could.
And again, your campaign is kicking off in 2 weeks.
Correct.
Share the air. What are y'all going to be doing to spread the word to get people involved?
Well, we already do.
We've got our campaign's going to be basically with through media, Share Air. There's going to be a series of commercials that are going to be or public information announcements that are going to be aired at different times, different to try to capture as much of the Rio Grande Valley's audience as possible, both young, adults, youth, and as well as also the Spanish-speaking community.
And I'm glad you're targeting the youth, because they say, I've read over and over, that kids are starting so much younger now.
They are. Children 12, 13 years old are trying their first cigarette and addicted by the time they're 14, 15 years old to tobacco
And you always
use.
hear people say it's the hardest habit to break.
It is, but there is help available. There are quit lines available. There are resources. A lot of people say, well, I can't afford nicotine replacement, but the cost of, if you look at the costs of using tobacco these days, a pack of cigarettes is not cheap.
Right, right.
So that's why we're here, aware.
And if people want to get involved in your coalition, become a member, can they do it? Do you have meetings once a month? How does it work?
Yes, we do. We have monthly meetings, and they are on the third Tuesday of the month.
On Wednesdays, Wednesdays.
Third Wednesday of the month. They are during lunch, and it's a working lunch. We have several professionals that are part of it. I myself am a police officer. There's other police officers that represent their departments there. We have counselors from schools and private counselors as well. Several different organizations. We have about maybe 20 members at this time, and we're always looking forward to bringing in some new membership.
Well, thank you so much for sharing that important information. I know lots of viewers right now listening and taking it all in, so thanks again.
Thank you, Tina.
Thank you.
All right. When we come back, it's time to talk tamales. McAllen getting ready for Tamale Fest. Details right after the break. Stay with us.